Captain Dr. Maya Reeves had spent 3 years hiding in plain sight, her military trauma surgeon credentials buried beneath blue scrubs and clipboard rounds at St. Catherine's Community Hospital. She'd traded battlefield triage for bedpans, choosing the monotonous rhythm of civilian nursing over the weight of her former rank. But when budget cuts force the hospital administrator to terminate the quiet nurse who keeps to herself, Maya walks out those sliding doors, believing she's finally free from both worlds. 4 hours later, a Black Hawk helicopter touches down on the hospital's rooftop helipad, rotors screaming over the parking lot, and 2 officers in dress uniform stride through the emergency department, asking for Captain Reeves by rank. The crisis unfolding 300 miles north doesn't care that she resigned her commission, doesn't care that she spent 1,000 nights trying to forget the faces she couldn't save. Sometimes the skills that haunt you are the only ones that can prevent history from repeating itself. And Maya is about to learn that you can't outrun your purpose, especially when 53 lives hang in the balance, and she's the only surgeon in the country with the specific battlefield experience to save them. Maya Reeves had perfected the art of invisibility over the course of 3 years, 2 months, and 16 days. She moved through St. Catherine's Community Hospital like a ghost in blue scrubs, her presence so unremarkable that most staff couldn't recall her face even after working alongside her for months. She preferred the night shifts, the fluorescent-lit hours when the hospital settled into its nocturnal rhythm and human interaction compressed into essential exchanges. Her efficiency was legendary but unsung. Patients stabilized under her care without quite understanding why they felt safer when she was in the room. Fellow nurses appreciated her competence but found her distance impenetrable, a wall constructed from polite smiles and deflected personal questions. The termination meeting lasted exactly 7 minutes. Hospital Administrator Gerald Hutchins barely made eye contact as he slid the papers across his pressboard desk, his discomfort palpable in the overheated office that smelled of burned coffee and budget anxiety. "It's nothing personal, Maya," he'd said, using her first name with the false familiarity of someone trying to soften a blow he didn't have the courage to deliver cleanly. The board approved cuts across all departments. Last hired. First fired, it's just policy. Maya had nodded, signed where indicated, and felt something like relief flood through her chest. She'd been running for so long that even disaster felt like forward motion. 20 minutes later, she'd cleaned out her locker 3 spare scrubs, a coffee mug she'd never used, and a photograph of her graduation from nursing school that wasn't actually from nursing school at all, but from her commissioning ceremony at the Uniformed Services University, carefully cropped to remove her captain's bars and the combat medical badge that had cost her more than she could articulate. The February morning was crystalline and cold as she pushed through the hospital's main entrance for what she assumed would be the last time. Her 12-year-old Honda Civic sat in the far corner of the employee lot, right where she always parked it, equidistant from the emergency department and the loading docks, positioned for the fastest possible exit in any emergency. Old habits, she thought, the kind of tactical thinking that never quite leaves your neural pathways even when you desperately want it to. She'd learned threat assessment in a classroom at Fort Sam Houston and perfected it in field hospitals where the difference between paranoia and preparation was measured in lives saved or lost. Now it just made her the weird nurse who parked in the same spot every shift and counted exits in every building she entered. Maya sat in her car for a long time, engine running, heat blasting against the winter cold, and tried to feel something about being unemployed. Freedom should have tasted sweet, she thought. This was what she'd wanted, wasn't it? Distance from responsibility, from the weight of decisions that could never be unmade, from the ghost feeling of blood on her hands no matter how many times she scrubbed them clean. She'd left the army 18 months after her last deployment, turned in her commission with all the proper paperwork and exit interviews, and constructed a new identity from scratch. Maya Reeves, RN, with a resume that showed nursing school in Seattle and clinical rotations in pediatrics and oncology, with references who would confirm her competence and her quietness, and absolutely nothing about the 32 months she'd spent in forward surgical teams in Afghanistan, the 2 Bronze Stars she'd earned and never displayed, or the 60-hour surgery marathon in a field hospital outside Kandahar that had saved 14 soldiers but left her with hands that trembled for months afterward. The PTSD diagnosis had been delivered by a kind-faced psychiatrist at Walter Reed, who'd probably given the same speech 1,000 times. You've experienced traumatic stress in a combat environment. What you're feeling is normal. Treatment is available. You're not alone. But Maya had felt alone, desperately and completely alone, surrounded by people who'd never understand what it meant to perform emergency thoracotomies, while mortars impacted close enough to shake dust from the ceiling, to make life-or-death decisions with incomplete information and inadequate supplies, to wash other people's blood from your hair and then sit down to write letters to their mothers. The numbness had started as a protective mechanism and gradually become her permanent state, a buffer between the person she'd been and the person she was trying to become. She'd chosen Street Catherine's specifically because it was small and unremarkable, a community hospital in a mid-sized city where nobody asked too many questions, and the nursing shortage meant they'd hire anyone with valid credentials. The work had been exactly what she'd hoped for: routine, predictable, safe. IV starts, and medication, administration, wound care, and patient education. The kind of nursing that required competence, but not brilliance, that demanded consistency, but not heroism. She'd been spectacularly overqualified and perfectly content with that arrangement. Let someone else make the hard calls. Let someone else carry the weight. She'd done her time, paid her dues, earned the right to fade into comfortable mediocrity. Except that mediocrity had just fired her, and now she was 34 years old with a resume that was half fiction and no clear path forward. Maya pulled out her phone and stared at the blank screen, trying to remember what normal people did when they lost their jobs. Updated LinkedIn profiles, she supposed, called friends for emotional support, made plans to travel or retrain or reinvent themselves. But her LinkedIn profile was a carefully constructed lie. Her friends were mostly former military colleagues she'd deliberately lost touch with, and the idea of reinvention exhausted her before she even began. She'd already reinvented herself once, and it had taken everything she had. The rational part of her brain catalogued next steps with military precision: update resume, file for unemployment, research other hospitals in the area, maybe finally see that therapist the VA had been recommending. The irrational part, the part that still woke up at 0:30 from dreams of arterial spray and the specific sound that dying people make when their lungs fill with blood, whispered that maybe this was the universe telling her something. Maybe she was never meant to escape. Maybe some experiences branded you so thoroughly that no amount of distance or denial could ever wash them away. Maybe Captain Dr. Maya Reeves, trauma surgeon, was always going to be more real than Maya Reeves, RN, no matter how many years she spent hiding in plain sight. She was still sitting there, engine running, thoughts spiraling, when the sound reached her. It came from the north, a distant rhythmic thumping that most people wouldn't have recognized but that sent ice straight through Maya's chest. She knew that sound, had known it in a dozen different contexts, from medevac arrivals that meant more casualties incoming to the blessed relief of evacuation flights that meant she could finally sleep. Helicopter rotors, heavy transport by the sound of them, getting closer. Maya looked up through her windshield and watched as the Black Hawk helicopter appeared over the tree line, military green and unmistakable, banking in a wide circle toward Street Catherine's rooftop helipad. Her heart rate spiked, and she forced herself to breathe through it. "Not your problem," she said aloud, her voice strange in the car's enclosed space. "Not your world anymore." But her hands were already turning off the ignition, her body already responding to protocols she'd thought she'd left behind. She stood in the parking lot and watched as the helicopter touched down on the roof, rotors still spinning, and two figures in dress uniform emerged and disappeared into the rooftop access. They moved with purpose, and Maya knew with absolute certainty that whatever brought a military helicopter to a civilian hospital in the middle of a Tuesday was bad, really bad. The kind of bad that required specialized skills and specific experience. The kind of bad that, somewhere in the back of her mind where instinct lived, she knew had something to do with her. Maya started walking back toward the hospital before she consciously decided to move, her feet carrying her across the parking lot while her brain scrambled to catch up. This was stupid. She didn't work here anymore. Whatever crisis was unfolding, it wasn't her responsibility. She'd signed her separation papers, turned in her commission, built a whole new life specifically to avoid moments like this. But even as she thought it, her hands were checking her pockets for her ID badge, the one she'd forgotten to return in the chaos of her termination, and her legs were lengthening into the efficient stride she'd developed for moving quickly through combat. Hospitals without appearing to run. The emergency department was buzzing when she came through the automatic doors. Staff members clustered in small groups, everyone staring toward the elevators or up at the ceiling where the helicopter rotors were still audible even through the building's infrastructure. Maya spotted Gerald Hutchins near the nurse's station, his face pale and confused, talking rapidly on his cell phone. She moved past him without making eye contact, following the same instinct that had guided her through a dozen different crises, the bone-deep certainty that something terrible was happening, and she needed to understand what. The elevator doors opened, and two officers stepped out. Both wore dress blues. Both carried themselves with the rigid bearing of people delivering serious news. The older one, a colonel by his insignia, scanned the emergency department with the efficient sweep of someone conducting threat assessment, and his eyes locked onto Maya with laser focus. She froze, every muscle in her body going still the way prey animals do when a predator spots them. He knew. Somehow, he knew exactly who she was. "Captain Reeves," he said, his voice carrying across the space with the kind of authority that made everyone else fall silent. Not Maya, not Miss Reeves, Captain. Her rank, the one she'd resigned, the identity she'd tried to bury under blue scrubs and careful anonymity. "We need to talk. It's urgent." The conference room they commandeered was barely large enough for the four of them. Colonel Marcus Brennan, Major Sarah Chen, Gerald Hutchins hovering nervously by the door, and Maya sitting across from the officers with her hands folded on the table to keep them from shaking. The folder Brennan laid on the table between them was marked with security classifications Maya hadn't seen in 3 years, the kind of designations that meant people had died or were about to die, and the information inside couldn't be allowed to reach the wrong hands. Her mouth went dry, and she fought the urge to stand up and walk out, to maintain the fiction that she was just a civilian nurse who had nothing to do with whatever classified disaster had brought a military helicopter to her doorstep. Brennan didn't waste time on pleasantries. 3 hours ago, there was an incident at the Westfield Chemical Research Facility in northern Pennsylvania. An explosion in one of their experimental labs released an unknown chemical compound into the atmosphere. 53 workers were exposed before the facility could be locked down. Emergency responders transported them to Mercy General Hospital in Westfield, but the staff there doesn't have experience with mass casualty chemical exposures, especially not with unknown compounds. Symptoms are escalating rapidly: respiratory distress, tissue necrosis, neurological impairment. 4 people are already dead, the rest are deteriorating fast. Maya felt her professional instincts kick in automatically, her brain already sorting through differential diagnoses and treatment protocols, even as she tried to maintain emotional distance. "They need a toxicology specialist," she said, keeping her voice level. "Chemical weapons expert, someone from the CDC or USAMRICT. I'm a trauma surgeon, Colonel, not a toxicologist, and I'm not in the army anymore." Major Chen leaned forward, her expression intense. "We have toxicologists on the way, Captain. But the analysis is going to take hours, maybe days, to identify the specific compound and develop targeted treatments. These people don't have days, they don't have hours. What they have is a suite of symptoms that match nothing in any database, and a medical staff that's overwhelmed and underprepared. She pulled a tablet from her bag and turned it toward Maya, displaying what looked like field reports and medical imaging. Look at these presentations. The combination of rapid onset respiratory failure with progressive tissue breakdown and severe neurological symptoms, it's not matching any known industrial chemical. Maya looked at the screen despite herself, and her stomach dropped. The images showed exactly what Chen described. Lungs that looked like they'd been scoured from the inside, skin exhibiting necrosis patterns that resembled burns but weren't, pupils blown wide in a way that suggested brainstem involvement. She'd seen similar presentations exactly once in her career. During a deployment she didn't talk about to a location, she'd signed a dozen NDAs promising never to discuss. Her hands clenched on the table. Where exactly was this research facility? She asked quietly. What kind of work were they doing? Brennan and Chen exchanged glances, and Maya knew she'd guessed right. Westfield Chemical has contracts with the Department of Defense, Brennan admitted. Some of their research involves experimental compounds. The facility is technically civilian, but they work on classified projects. That's all I can tell you without clearance. Chemical weapons, Maya said flatly. You're telling me that a civilian research facility was developing chemical weapons on American soil. There was an accident, and now 50+ people are dying from exposure to something that doesn't officially exist. She leaned back in her chair, a bitter laugh escaping before she could stop it. And you want me to fix it? The surgeon you didn't bother to contact in 3 years, who resigned her commission specifically to get away from this exact kind of situation. You want me to walk into a hot zone with an unknown chemical agent and somehow save people when you don't even know what's killing them? We want you to try, Chen said, and there was something raw in her voice that cut through Maya's anger. Because you're the only surgeon in the country who has experience with similar presentations. Your work in, she glanced at Hutchins, recalibrated, in certain overseas locations included treating exposures to experimental compounds. You developed field protocols for managing symptoms when you didn't have time for formal identification. You kept people alive long enough for proper treatment. That's what these people need, Captain. Someone who can think on their feet, who can manage a mass casualty event with incomplete information, who has the specific skill set that this situation requires. Maya stared at the tablet screen, at the images of people whose bodies were being destroyed from the inside by something that wasn't supposed to exist. She thought about the easy out she'd been handed this morning, the termination that had felt like freedom. She thought about the quiet life she'd built, the careful distance she'd maintained from anything that reminded her of who she used to be. And she thought about 53 people who were dying right now, this moment, while she sat in a conference room trying to protect her own peace of mind. I'm not re-enlisting, she said finally. If I do this, I do it as a civilian contractor. I want that in writing before I step foot on that helicopter. No reinstatement of commission, no extensions, no backdoor recruitment. I help with this one situation, and then I walk away. Clear? Brennan nodded slowly. We can arrange that. The paperwork will be ready by the time we're airborne. You'll have full operational authority as the lead medical consultant, civilian status maintained, with the understanding that this is a single incident contract. He pulled out his phone and started typing with the efficiency of someone who'd negotiated similar arrangements before. We have a full mobile surgical unit being set up at Mercy General. You'll have access to whatever resources you need, whatever personnel you request. This is top priority. Captain, sorry, Doctor. Reeves, the White House is getting hourly briefings. If this compound escaped containment, if there's any chance of wider exposure, we're looking at a potential catastrophic scenario. Then why aren't there a dozen specialists already on site? Maya demanded. If this is as serious as you're saying, I shouldn't be your first call. I should be part of a whole team. You are part of a team, Chen said. Toxicologists are en route from Atlanta and Fort Detrick. Chemical weapons specialists are being pulled from 3 different installations. Environmental containment units are already on the ground, establishing perimeters. But none of them can do what you can do, which is keep people alive while we figure out what we're dealing with. The facility's head researcher is one of the casualties, unconscious and deteriorating. The other scientists who might know the compound's composition are either dead or incapacitated. We're working blind, and people are dying faster than we can establish proper protocols. Maya closed her eyes and tried to find the numbness that usually protected her from moments like this, the emotional distance that let her function when everything inside was screaming to run. It wouldn't come. Instead, she felt something she hadn't experienced in 3 years. Clarity. Terrible, unwanted clarity about exactly what she needed to do. She'd spent 1,000 hours in therapy talking about how she couldn't save everyone, about accepting the limits of her control, about learning to live with the decisions she'd made and the people she'd lost. But she'd never quite learned to live with herself if she walked away from people she might actually be able to help. 4 hours, she said, opening her eyes and meeting Brennan's gaze. I need to make phone calls, get my affairs in order, grab my gear. If I'm doing this, I'm doing it properly. I need my surgical kit from storage. It has specialized equipment that might be relevant. And I need access to my service records, specifically my field notes from deployments I'm not supposed to talk about. If the presentations are similar, my protocols from those situations might be applicable. Already arranged, Brennan said, sliding a phone across the table. Secure line. Your storage unit in Seattle has been accessed. Contents are being transported to Mercy General as we speak. Your complete military medical file, including classified deployments, is being compiled and will be available on the helicopter. We pulled your security clearance out of inactive status 2 hours ago. He stood, and Chen followed suit. We have a bird, fueled and ready. The sooner we're airborne, the more lives you might be able to save. Maya looked at Hutchins, who'd been silent throughout the entire exchange, his face slack with shock at the revelation that his quiet night shift nurse was apparently some kind of military medical specialist. I'm going to need that termination paperwork voided, she told him. And a leave of absence approved, effective immediately. Indefinite duration, medical emergency deployment. She felt a grim smile tug at her lips. Assuming I still have employee rights, as of 7 minutes ago. Hutchins nodded mutely, already pulling out his own phone. I'll handle it. Maya, I didn't know. If I'd had any idea. You weren't supposed to know. Maya interrupted. Nobody was. That was kind of the point. She stood, her legs steadier than she expected, and gathered her coat from the back of her chair. 3 years of carefully constructed civilian life was dissolving around her like smoke, and she was surprised to find that the grief she'd expected wasn't there. Instead, there was only the familiar weight of responsibility settling back onto her shoulders, heavy and terrible, and oddly comforting in its familiarity. This was who she was, apparently. Not the quiet nurse who hid from her past, but the surgeon who ran toward disasters, because someone had to, and she had the skills to help. Let's go, she said to Brennan and Chen. If we're doing this, we need to move. Every minute we waste is another minute those people are deteriorating. She was already running through mental checklists, prioritizing interventions, calculating resource needs. Her brain had shifted into operational mode automatically, the same focused intensity that had gotten her through combat deployments and mass casualty events. Fear was there, hovering at the edges, but it was manageable. She'd learned a long time ago that courage wasn't the absence of fear but the decision to act despite it. The walk through the emergency department drew stares from staff who'd worked alongside her for months without really seeing her. Now they watched as she strode toward the elevators flanked by 2 military officers, her bearing suddenly different, the invisible quality she'd cultivated stripped away to reveal something harder and more purposeful underneath. Maya didn't look at any of them. Her focus was already forward, already on the helicopter waiting on the roof, and the people dying 300 miles north, who needed someone willing to walk into hell and drag them back out again. The rotors were still spinning when they emerged onto the rooftop, the downdraft fierce and cold. Maya ducked instinctively, muscle memory from 100 different helicopter insertions, and climbed aboard with practiced ease. The crew chief handed her a headset, and she settled into the jump seat while Brennan and Chen strapped in across from her. The pilot's voice crackled through her headset. "Welcome aboard, ma'am. Estimate 90 minutes to Mercy General. Weather's clear, winds favorable." "Copy that," Maya responded automatically, and felt a strange sense of homecoming at the familiar weight of the headset, the vibration of the aircraft, the purposeful efficiency of a military operation in motion. The helicopter lifted off smoothly, banking away from Street, Catherine's, and Maya watched through the window as the hospital grew smaller beneath them, the parking lot where her civilian life had ended just visible in the distance. Brennan handed her a tablet. "Your records. Everything we could pull from your service file, including classified deployments. Read up on the flight. When we land, there won't be time for preparation. You'll need to hit the ground running." He paused, his expression softening slightly. "For what it's worth, Captain, I'm sorry we had to pull you back into this. I read your separation paperwork. I know you left for good reasons, if there was any other way. But there isn't," Maya finished for him. She took the tablet and pulled up her service record, scrolling past commendations and deployment dates to find the files she needed. There never is, with situations like this. That's why people like me can't ever really leave, no matter how hard we try. The skills that make us good at this work, they're also the things that make it impossible to walk away when we're needed. She looked up from the screen, meeting his eyes. "I just hope I'm not too rusty. It's been 3 years since I worked a real trauma, and I've never dealt with a mass casualty chemical exposure on this scale without full support infrastructure." "You'll adapt," Chen said with quiet confidence. "It's what you do. Your service record shows consistent performance under impossible conditions. 3 Bronze Stars, 2 Army Commendation Medals, and a file full of incident reports where you saved lives that shouldn't have been savable. You're exactly the right person for this, even if you wish you weren't." Maya didn't respond, turning her attention back to the tablet and losing herself in the familiar language of medical protocols and deployment logs. The helicopter thrummed beneath her, carrying her north toward whatever disaster waited, and she felt herself slipping back into the identity she'd tried so hard to escape. Captain Dr. Maya Reeves, trauma surgeon, specialist in impossible situations and lost causes. The quiet nurse was gone, burned away by necessity and the inescapable truth that some skills were too important to waste on invisibility. She had 90 minutes to remember how to save the unsavable. Somehow, it didn't seem like nearly enough time. Mercy General Hospital looked like a war zone, which was grimly appropriate given the situation. Maya could see the organized chaos from the air as the helicopter circled for landing military vehicles, forming a perimeter around the building. Personnel in hazmat suits moving between structures, decontamination tents set up in the parking lot, and what looked like a mobile command center installed near the emergency department entrance. This wasn't a hospital anymore. It was a forward operating base, the kind of installation she'd worked in a dozen times in places that were supposed to be much farther from American soil. The cognitive dissonance of seeing military medical operations on domestic ground was disorienting, a collision of worlds she'd worked hard to keep separate. The helicopter touched down on a marked landing zone in what used to be a soccer field adjacent to the hospital. Maya was unbuckling before the skids fully settled, her body moving on autopilot, while her mind raced through what she'd read during the flight. The incident had occurred at 0800 hours. First casualties arrived at Mercy General at 0930. It was now 1315, which meant the most critical patients had been symptomatic for over 5 hours. In her experience with similar compounds, and she had to keep reminding herself that this might not be similar at all, that she was operating on assumptions that could prove fatal if she was wrong. 5 hours was approaching the point of no return for certain systemic damage. If she was going to make a difference, It needed to happen in the next few hours. After that, they'd be managing deaths instead of preventing them. A woman in full protective gear met them as they climbed out of the helicopter, her face barely visible behind the respirator mask. She pulled it down briefly to speak, revealing sharp features and exhausted eyes. "Dr. Reeves? I'm Dr. Amanda Foster, Mercy General's Chief of Emergency Medicine. Thank God you're here. We've lost 2 more patients in the last hour, and we're running out of ideas. The symptoms don't match anything we've been able to identify, and standard treatments aren't working. Some interventions seem to make things worse." Maya's mind immediately filed that last piece of information as critical. What interventions made things worse? She demanded, following Foster toward a decontamination tent where protective gear was laid out and waiting. Brennan and Chen peeled off toward the command center, leaving Maya to focus on the medical crisis. Specifically, what did you try? What was the reaction, and how fast did deterioration occur? Foster pulled out a tablet as they walked, her voice clipped and professional but underlaid with barely controlled panic. Patient 17, 32-year-old male, presented with moderate respiratory distress and skin lesions. We initiated standard treatment for chemical burns, IV fluids, oxygen supplementation, topical treatments for the skin damage. Within 20 minutes, his respiratory distress escalated to full failure. We had to intubate, but even with mechanical ventilation, his oxygen saturation kept dropping. The skin lesions started spreading, and he developed what looked like internal bleeding blood in his urine and stool, bleeding from mucous membranes. He coded twice. We got him back, but he's barely holding on. Maya stopped at the entrance to the decontamination tent, processing. Rapid deterioration following standard intervention suggested either an allergic response, which seemed unlikely across multiple patients, or treatment that was somehow incompatible with the compound's mechanism of action. "The topical treatments, what did you use?" she asked, her mind already racing through possibilities. Some chemical agents reacted with water or oxygen or common medical compounds, transforming into more dangerous substances when exposed to standard first aid. "Standard burn protocol," Foster said, consulting her notes. "Saline irrigation, silver sulfadiazine cream, antibiotic ointment. Why? You think the treatments themselves caused the acceleration?" "Maybe," Maya said grimly. "Depending on the compound, introducing certain substances could catalyze reactions that make the original exposure worse. We saw something similar with..." She caught herself, remembered the NDAs, recalibrated, with certain experimental agents. The first rule became do no harm, which meant sometimes doing nothing until we understood the mechanism better. "Where are the deceased? I need to see them before I see the living patients. The dead can tell us things the living can't yet." Foster's expression showed surprise, but she nodded and spoke into her radio. "Dr. Chen, I need access to the morgue. Doctor. Reeves wants to examine the deceased before patient rounds." She looked back at Maya. "The bodies are in temporary cold storage in the basement. We've been treating this as potentially infectious, so they're in isolation. You'll need full PPE." "Good," Maya approved. She stepped into the decontamination tent and began the familiar process of suiting up first the inner layer, then the protective suit, gloves taped to sleeves, respirator mask checked and sealed, hood secured, outer gloves, boots. Each piece clicked into place with muscle memory she hadn't used in years, her hands moving through the ritual with practiced efficiency. The suit felt like returning to an old skin she'd shed, uncomfortable and confining but also strangely protective. Inside the layers of barrier protection, she could almost pretend she was someone else. The surgeon instead of the woman, the professional instead of the person who'd spent 3 years running from exactly this kind of situation. The walk through the hospital was surreal. Staff members pressed against walls to let them pass, their faces showing various combinations of fear, exhaustion, and desperate hope. Maya kept her eyes forward, focusing on Foster's back and the path ahead, rather than the trauma bays she could glimpse through open doors. She caught snapshots anyway, patients on ventilators, skin mottled with spreading lesions, medical teams working with the frantic energy of people who knew they were losing the battle. The smell hit her even through the respirator. Blood and chemicals and fear, the distinctive scent of mass casualties that was apparently universal regardless of setting. The temporary morgue was exactly what she expected. A hastily cleared storage room in the basement. Industrial refrigeration units brought in and lined up along one wall. Bodies in black bags, tagged with numbers instead of names. 6 bags so far. Maya felt the weight of those 6 deaths settle on her shoulders alongside all the others she carried, the cumulative burden of people she hadn't been able to save. But this was different, she reminded herself. These people had died before she arrived. She couldn't have saved them. Her responsibility was to the ones who were still alive, still fighting, still savable if she could figure out what she was dealing with. "I need to examine them systematically," Maya told Foster, who was hovering near the door with the protective posture of someone who desperately didn't want to be in this room. "All 6. Full visual assessment. I'm looking for patterns in tissue damage, progression of symptoms, anything that might indicate mechanism of action. I need you to give me the timeline for each when they were exposed, when they arrived here, what symptoms they presented with, what interventions you attempted, and how long from exposure to death. Can you pull those records?" Foster nodded and started working her tablet. "I'll have them ready before you finish the first exam. Dr. Reeves, what are we dealing with here? The CDC said it might be a nerve agent variant, but the presentation doesn't quite match. The chemical weapons specialists are saying it could be a blister agent, but again, not exactly right. Nobody seems to know for sure." "Because it's probably experimental," Maya said, unzipping the first body bag with steady hands despite the tremor trying to start in her fingers. "Something designed in a lab that doesn't have a name yet, doesn't exist in databases, doesn't match known profiles because it was engineered specifically to be different. Which means we're not going to treat this by matching it to something we know. We're going to have to figure out what it does and counter that, regardless of what it is." The first body was a woman in her 40s, her hospital gown still in place beneath the bag. Maya documented everything methodically, the distinctive pattern of skin lesions, concentrated around the face and hands areas that would have been exposed when the incident occurred. The lesions weren't quite burns, weren't quite chemical corrosion, but something in between. The tissue had a strange crystalline quality in some areas, almost like the cellular structure had been fundamentally altered. She checked the mucous membranes and found hemorrhaging, examined the fingers, and found cyanosis that suggested severe respiratory compromise before death. This woman had essentially drowned in her own blood and fluids while her skin crystallized and her organs shut down. It was a horrific way to die. Maya moved through the remaining 5 bodies with clinical efficiency, pushing emotion aside to focus on data collection. Each examination added pieces to the puzzle. The pattern of lesions was consistent across all victims, always worst at exposure sites, but spreading systemically over time. Internal bleeding was universal, suggesting the compound affected blood coagulation or vessel integrity. Several bodies showed signs of neurological damage, brain swelling, hemorrhage in the brainstem. The timeline Foster provided showed progression from exposure to death ranging from 4 to 7 hours, with younger, healthier victims surviving slightly longer. None of the standard treatments had made any measurable difference. In fact, like Foster had noted, some interventions seemed correlated with faster decline. "Okay," Maya said, straightening up from the last examination and stripping off her outer gloves. "I need to see the living patients now, but I'm going to approach this differently than standard protocol. No aggressive interventions until we understand mechanism better. We're going to focus on supportive care, maintaining oxygenation, managing pain, keeping them stable while we figure out what specifically is happening at the cellular level." "Do we have electron microscopy available?" I want tissue samples from both deceased and living patients analyzed for structural changes. Foster was already making notes. We can arrange that. There's a research lab on site that has the equipment. What are you thinking? I'm thinking this compound doesn't just damage tissue, it changes it, Maya said, her mind racing through what she'd seen. That crystalline quality in the lesions, the way the damage spread systemically even from localized exposure, the multi-organ failure that doesn't respond to standard support, it's consistent with something that alters cellular structure at a fundamental level. If I'm right, then treating it like a toxin or a burn or an infection is wrong. We need to find a way to interrupt the transformation process, to stop the spread before it reaches critical systems. They rode the elevator back to the main floor in silence, Maya reviewing everything she'd learned and trying to construct a treatment approach from inadequate data and educated guesses. This was exactly the kind of situation she'd hoped to never face again. Lives depending on her ability to make the right call with incomplete information, no time for careful analysis, and consequences that would haunt her regardless of outcome. But this was also what she was good at, what all her training and experience had prepared her for. She'd learned combat medicine in the harshest classroom imaginable, and if that education was going to mean anything, it had to mean being willing to use those skills when they were desperately needed. The ICU was a study in controlled chaos. Every bed was full, every patient connected to monitors and IVs and ventilators, every medical professional moving with the exhausted determination of people who'd been fighting a losing battle for hours. Maya scanned the space with practiced efficiency, her brain automatically triaging who was most critical, who was most savable, where her attention needed to focus first. A young man in bed 3 was actively coding, his monitor screaming alarms while a team worked compressions. An older woman in bed 7 was conscious but deteriorating, her eyes wide with terror as she watched her own skin darken with spreading lesions. Children in beds 9 and 10, which made Maya's stomach clench, because children were always the worst, always the ones that stuck with you longest. "Status," she demanded, her voice carrying the automatic authority of someone used to commanding emergency situations. The room seemed to pause, dozens of eyes turning toward her, taking in the military bearing and the confidence that came from experience. "I need rapid updates on the 10 most critical patients. Current vitals, intervention history, progression, timeline. 2 minutes. People. Go. End." The information came in rapid-fire bursts, nurses and doctors reporting from their assigned patients while Maya processed and prioritized. Patient 3, the one coding, was already too far gone, brain damage from repeated cardiac arrests making meaningful recovery unlikely even if they could stabilize his other systems. She hated making that calculation, hated the cold math of triage, but resources were limited and she had to use them where they'd make the most difference. Patient 7, the conscious woman, was stable enough for the moment, her progression slower than some others. The children were critical but not yet in immediate failure, which meant they had time, maybe, if she could figure out the right approach. "Okay, listen up," Maya said, raising her voice to cut through the noise. "We're changing protocols effective immediately. I know you've been following standard chemical exposure procedures, and I know some of you have been trained in nerve agent response or blister agent management. Forget all of it. This compound doesn't match any known category, which means our standard playbook might be making things worse." She moved to the center of the room, where a whiteboard on wheels had been set up for patient tracking. New approach, minimal intervention, maximum observation. We stabilize critical systems, airway, breathing, circulation, but we stop trying to treat the lesions directly. No topical agents, no irrigation beyond initial decontamination, no administration of standard antidotes. We're going to support these people's bodies while we figure out exactly what's happening at the cellular level. A young resident raised his hand tentatively. "Dr. Reeves, if we're not treating the skin damage, won't it just keep spreading?" Some of these patients are showing progression to deeper tissues. I know, Maya cut him off. And that's terrible, and every instinct we have says to intervene. But I've seen similar presentations before, and I've seen aggressive treatment accelerate the damage. We think we're helping, but we're actually feeding the process. She grabbed a marker and started sketching on the whiteboard. This compound appears to alter cellular structure rather than just damaging it. It's spreading through the body, transforming healthy tissue into something else. When we apply standard treatments, moisture, oxygen, antibiotics, we might be providing resources that fuel the transformation. So we're going to try the opposite. Controlled environment, minimal intervention, and very careful observation of what happens without our interference. The room was silent. Dozens of medical professionals absorbing this radical shift in approach. Maya could see the doubt on some faces, the desperate hope on others, the exhaustion on all of them. These people had been fighting for hours without progress, watching patients die despite their best efforts. She was asking them to trust her judgment based on experience she couldn't fully explain, to abandon training and protocols in favor of experimental approaches that might or might not work. I know this is counterintuitive, she continued, her voice gentler. I know it feels like giving up. But sometimes the most important thing we can do is stop and think instead of just doing everything we can think of. We have people working on identifying this compound, figuring out its exact composition and mechanism. Until we have that data, our job is to keep these patients alive and stable. That means pain management aggressive, whatever it takes to keep them comfortable. That means maintaining their basic systems, oxygenation, circulation, nutrition, and that means watching carefully for any changes, any patterns, anything that might give us clues about how to actually counter this thing instead of just throwing standard treatments at it and hoping something works. Dr. Foster stepped forward, her expression showing cautious support. Dr. Reeves has specialized experience with atypical chemical exposures, she announced to the assembled staff. She's here as a consultant on this incident, and she has operational authority for treatment decisions. I know this is different from what we've been doing, but our approach hasn't been working. We've lost 6 people, and we're about to lose more if we don't try something new. She looked at Maya. What do you need from us? Team assignments, Maya said immediately. I need 3 people on each critical patient, 1 to manage airways and breathing, 1 to handle pain management and comfort care, 1 to document every single change in condition, no matter how minor. I need a lab team working on tissue samples, electron microscopy, cellular analysis, chemical composition if possible. I need environmental monitoring. Is there any ongoing contamination, any risk of secondary exposure, any spread beyond the initial patients? And I need someone to coordinate with the specialists, en route toxicologists, chemical weapons experts, whoever else is coming. They need to know what we're seeing here so they can focus their analysis. The room erupted into organized activity as Foster started making assignments and distributing responsibilities. Maya watched for a moment, ensuring the chaos was productive rather than destructive, then turned her attention to patient 7, the conscious woman whose eyes had been tracking her throughout the briefing. She approached the bed slowly, making herself visible, letting the patient see her coming rather than surprising her. Hi, Maya said quietly, pulling up a stool next to the bed. I'm Dr. Reeves. I'm here to help figure out what's making you sick and how we can stop it. Can you tell me your name? Lisa, the woman whispered, her voice rough from intubation attempts earlier. Lisa Brennan. Am I going to die? The question was direct, cutting through any possibility of comfortable lies or false reassurances. Maya appreciated the honesty, even as it made the moment harder. I don't know, Maya admitted, because she'd learned long ago that patients deserved truth, even when it was painful. You're very sick, and we're still figuring out exactly what's making you sick. But I'm going to do everything I can to keep you alive while we work on that. I need you to help me, though. I need you to tell me everything you remember about when you were exposed, where you were, what you smelled or felt, Anything unusual. The more information I have, the better chance I have of helping you." Lisa's eyes filled with tears, but she nodded and started talking. She'd been in Lab 7 when the explosion occurred, working on what she thought was atmospheric testing for a new propellant compound. There'd been a flash, then a smell like burning plastic and citrus, then immediate burning sensation on her exposed skin. She'd activated emergency protocols, gotten herself and 3 colleagues to the decontamination showers, followed all the training, but the burning had kept getting worse, and her breathing had started to feel wrong, tight, and difficult. By the time the ambulance arrived, she could barely walk. Maya listened intently, mentally cataloging every detail. Burning plastic and citrus that suggested an aromatic compound, possibly with acidic components. Immediate contact pain that escalated even after decontamination meant it was absorbing into tissue quickly, not just sitting on the surface. Respiratory impact, suggesting either inhalation, exposure, or systemic circulation affecting the lungs. All of it consistent with something engineered to be penetrating and persistent, exactly the kind of thing you'd design if you wanted a chemical weapon that couldn't be easily washed off or treated. "You did everything right," Maya told Lisa firmly. "The decontamination, the quick response, all of it was exactly what you should have done. This isn't your fault. The compound you were exposed to is just really aggressive, and we're working on finding the right way to counter it." She adjusted the pain medication drip, watching Lisa's face relax slightly as the increased dose kicked in. "I'm going to do some tests, take some samples, and then we're going to get you as comfortable as possible while we figure out the treatment. Okay?" Lisa nodded, her eyes already drifting closed as the medication took effect. Maya stayed beside her for another moment, watching the monitors and noting the slow but steady decline in several parameters. Time was running out. She had hours, maybe less, to figure out what they were dealing with and how to stop it before the death count climbed from 6 to 16 to 26 to all 53. The weight of those potential deaths pressed down on her shoulders, familiar and terrible, but she pushed back against it with the iron discipline she'd developed over years of combat medicine. Fear and grief could wait. Right now, she had work to do. She stood and surveyed the ICU, this temporary battlefield where the enemy was invisible and the weapons were failing. Somewhere in the data they were collecting, in the tissue samples and patient histories and timeline progressions, there had to be answers. She'd found them before in worse circumstances with less information. She could find them again. She had to. Because the alternative failing these people the way the quiet nurse had failed to save herself from her own past was unacceptable. Maya pulled out her phone and called Brennan. "Colonel, I need the research facility's records, everything they have on what that lab was working on. I don't care about classification or clearance levels. People are dying, and I need to know what they were exposed to. Also, I need any subject matter experts on experimental propellants and aromatic chemical compounds, and I need them an hour ago." "On it," Brennan's voice crackled back. "The facility director is being escorted here now. He's been resistant about sharing classified information, but I'll make it clear that his cooperation isn't optional. Anything else?" "Prayer," Maya said, only half joking. "These people need a miracle, and I'm about out of medical science to offer them." She hung up and rolled her shoulders, feeling vertebrae crack with the release of tension, then dove back into the work. Patient by patient, system by system, trying to hold back death with inadequate tools and incomplete knowledge, while hoping desperately that understanding would come in time to matter. It was exactly the kind of impossible situation she'd fled 3 years ago, and exactly the kind of challenge that made her feel, for the first time in far too long, like she was exactly where she was supposed to be. The helicopter on the roof had carried her away from the quiet life she'd built. Maybe, just maybe, it had carried her back to herself instead.